Okay, I now call the National Forum for Heart Disease and Stroke Prevention's 2023 annual business meeting to order. Members will be voting today on two matters: approval of the Treasurer's report and election of directors. Each National Forum member organization has one voting representative. Voting today is via a poll question on your computer screen. If you're a National Forum voting representative, please vote. There will be 15 seconds to submit your vote on each question. In addition, if you have new business to bring before the membership, please use the chat function to bring it to the chair's attention before I call the new business at the end of the meeting. At this point, I'd like to call on our Secretary-Treasurer, Jay Bhatt, to call the roll.
Thank you so much, Mr. Chair, and happy to be here with all of you. For today's virtual meeting, the Zoom events attendance record will be used instead of a live roll call of members. With that, I turn it back over to you, Mr. Chairman.
Great, thanks very much. In addition to that, minutes from the 2022 annual business meeting are in the program book. Does anyone have any corrections? If yes, please place those corrections in the chat box. If there are no corrections, they will be automatically approved by being on the consent agenda. We have no changes placed in the chat box, thus the minutes are approved. Now, John Clymer will give the Executive Director's report.
In the years since our last business meeting, your National Forum has logged significant progress toward fulfillment of its mission to spark and lead collaborative action to achieve health equity and optimize cardiovascular health and well-being throughout society. The board and staff maintain a sharp strategic focus in line with the strategic plan updated this year. The plan continues to keep health equity and social determinants of health at the forefront of our programs. You can see that participation in the National Forum's virtual mid-year convening is on a sharp upward growth trend. Your presence indicates that you're getting value for your investment of time and participation. Turning to Move With the Mayor, you can see that it too is growing. Combining the Move With the Mayor active living, flu vaccination, and adult vaccination initiatives, we have 147 mayors in 35 states engaged in 2023. We have achieved or exceeded our recruiting goals for the entire year. Against a goal of engaging 60 mayors in the adult vaccination initiative, we involved 88, more than 30% of whom are from rural communities. Mayors are using social media to raise awareness about the health benefits of physical activity and get people engaged. They're using traditional media too to amplify their messages. We added a collaboration with the CDC Foundation, co-branding Live to the Beat and Move With the Mayor to amplify the Live to the Beat messages to African American and Blacks. We're measuring Move With the Mayor's impact in terms of community guide interventions that mayors are implementing in their cities, towns, and villages. You know the community guide is the gold standard for evidence-based public health programs, policies, and environmental changes to protect and improve population health. Since community guide evidence reviews quantify the impact of the interventions, we can estimate the magnitude of Move With the Mayor's impact on cardiometabolic health risk factors or outcomes. Move With the Mayor's cities are implementing an average of 5 community guide programs, policies, and infrastructure changes. The most commonly implemented community guide interventions by Move With the Mayor communities are infrastructure changes that encourage and make it easier for people to be physically active. This is significant because these interventions make a durable impact that will outlast the length of any mayor's term. The U.S. Conference of Mayors, the largest nonpartisan organization of mayors, formally urges mayors to use Move at the Mayor to improve mental and physical health and strengthen individual and community resilience. I'm excited to announce that the National Forum, in collaboration with the American Public Health Association, has received CDC funding to launch a new Move at the Mayor mental health initiative. As we just heard from the third panel, cardiometabolic and mental health are closely linked. So this new initiative aligns with the National Forum's goal to optimize cardiovascular health. As we heard from Dr. Cohen a few moments ago, it aligns with CDC's goal to improve mental health and prevent substance abuse and addiction. It also aligns with mayors' high priority on addressing the nation's mental health crisis. Turning to the Value and Access Collaborative, Congress and the Federal Trade Commission continue to investigate how PBM business practices affect consumers' access to medications, as we recommended. In partnership with the National Lipid Association, we formed a LDL cholesterol control roundtable. We've met throughout 2023 and are closing in on decisions about collective actions to improve cholesterol management and measurement. One of the strategies under consideration is pursuing a new or reinstated quality measure. With that in mind, the National Forum's immediate past chair, Warren Jones, secured appointment to the Battelle Institute's Partnership for Quality Measurement Measure Recommendation Group. This is significant because CMS shifted the Medicare quality measure work from the National Quality Forum to Battelle's Partnership for Quality Measurement. An unintended collision of laws threatens to force as many as 20% of community pharmacies out of business in the first half of 2024. This, of course, would have harmful consequences for underserved populations in areas without other sources of clinical care. It also would reduce people's access to pharmacist services that are proven to improve cardiovascular health. Building on the Value and Access Collaborative's joint policy statement on expanding access to health care and the 18 states that have implemented laws and regulations we recommended, we mounted a campaign this summer to educate public health, prevention, and health equity advocates about the vital role of community pharmacies. Our board member, Mike Kropp, led a virtual briefing in September. We engaged physicians in a messaging campaign about the valuable role of pharmacists and engaged mayors in educating other policymakers about the importance of community pharmacies. As Dr. Cohen pointed out, flu adversely affects cardiovascular health and vice versa. Thus, we updated the English and Spanish language shared decision-making guide for flu vaccination. You can see that it is co-branded with 10 Value and Access Collaborative organizations. The National Forum collaborated with FTI Consulting and the CDC Foundation to develop the business case for hypertension control. We convened public and private sector employers to advise us on tools that would help them make business decisions about helping employees manage their blood pressure. FTI developed a business impact model that estimates the financial impact of hypertension on business performance and a claims analysis guide, and we reconvened the employers to try out these tools. Additionally, with employers' guidance, we developed messaging about blood pressure management designed to resonate with business decision makers. Now, tools don't build anything unless someone puts them to use. We've shared the tools with the National Hypertension Control Roundtable for their dissemination to employers and secured funding to work with FTI and the CDC Foundation to put the tools on employers' radar. In her remarks earlier in this meeting, Mandy Cohen highlighted the alignment between CDC's priorities and the National Forum's programs. Another such alignment is our soon-to-be-released signature report on pregnancy and cardiovascular health. This new Sydney report will support the goal we share with CDC of improving health in young families as a foundation for lifelong health. That concludes an executive director's report. Now, I'm pleased to pass the microphone to our treasurer, Jay Bhatt, to give the corporate operations and finance report. Dr. Bhatt?
Thank you so much, John. I'd like to provide a report to the National Forum members, and I will start with our checking and business performance. So looking at our performance, we, between January 1st, 2023 and October 16th, 2023, have received and deposited $2,515,570.89. Wells Fargo business checking and business performance savings and First National Bank checking account balances as of October 16, 2023 are as follows. Checking $1,680,561.95. Savings $462,552.13. Wells Fargo total gives us $2,143,114.08. When we look to the First National numbers, we have $249,978 total, and total cash is $2,393,092.08. Pending receivables, $252,187.55. Total cash plus receivables as a result is $2,643,279.63. And as we look at the balance sheet comparisons for August 2023, and you can see them in your materials, we see that significant differences in month-to-month and year-to-year comparisons are possible. I'm reminding that the National Forum's revenue flow is irregular. Large chunks of funding arrive in some months, small amounts in others. So it's important to watch the trends rather than take snapshots. And our trends are healthy. We have August 2023 net assets is $2,799,267, up from August 2022 net assets of $2,354,956. And we've seen a healthy increase in revenues, and year to date thus far is $1,986,882, and that's as of August 31st, 2023, compared to 2022 year to date revenues at the end of the fiscal year was $2,053,100. Excuse me. The balance sheet has shown increasing financial strength over multiple years, continuing through today. The statement of activity shows that the National Forum continues to operate in the black, adding to its financial reserves, which is healthy. And I will now move to approve the treasurer's report.
Right, thanks very much, and I will second your motion, Jay. So at this point, I would like to ask members to vote on the approval of the treasurer's report using the pop-up window on your computer screens.
Okay, and the poll is now open. We will leave it open for about 15 seconds to capture all votes. So just a reminder, we are using the Zoom polling mechanism for your vote today. Calling for final votes. Polls now closed, and here are your results.
Great, thank you, and it appears the motion passes. Next up, in a moment, voting representatives will be asked to vote on the nominees for 2-year terms on the National Forum Board of Directors. You'll vote in the pop-up window on your computer screen. The Governing Committee and Board nominate the following slate of candidates for the Board of Directors for a 2-year term from 2023 to 2025. First up, the Honorable Jerome M. Adams, MD, MPH, 20th Surgeon General of the United States, Presidential Fellow, and Executive Director of Purdue's Health Equity Initiatives and Distinguished Professor of Practice at Purdue University. Second up, Margaret Meg Guerin-Calvert, who is Senior Managing Director and President, the Center for Healthcare Economics and Policy at FTI Consulting. And third up, Rosemary McGillen, Chief Marketing and Communications Officer at the American Red Cross. If you're a voting representative of a National Forum member, please vote in the pop-up window on your screen.
All right, and voting is now open. Again, using the Zoom poll for your vote today. About another 10 seconds. Last call for votes, please. Polling is now closed, and here are the results.
Great. Thank you very much. And please note that the Board of Directors has now elected the 2023-2024 officers. I will remain as your chair. Dr. Warren Jones will remain as past chair, and Mike Kropp was elected Secretary General. We will now move to the National Forum's award presentation. These will be facilitated by Julie Harville and Stacy Resendez.
The National Forum honors 2023 awards. This is Julie Harville, Director of Operations.
And this is Stacy Resendez, Operations Consultant.
The National Forum annually recognizes individuals and organizations who have made exceptional contributions to heart disease and stroke prevention. We are sorry we are not all together in person. However, we have received acknowledgments from the award recipients whose remarks we will share with all of you. The National Forum has presented 95 awards since the program began in 2009. Today, we will present 6 new awards. The National Forum Heart Healthy Stroke Free Award is presented to an individual and group whose work embodies the recommendations of the National Public Health Action Plan to prevent heart disease and stroke. The individual recipient is Madele Uganini.
She is being recognized for her scientific and clinical leadership on social determinants of health, eliminating disparities in cardiovascular disease, diversity in clinical trials, palliative care in heart failure, cardiovascular disease in women, and service as co-chair of the National Hypertension Control Roundtable.
I want to express my profound, heartfelt appreciation to the National Forum for this honor and recognition. It's a validation of all our efforts, really a team effort by the National Hypertension Control Roundtable to ensure equitable hypertension control. Our work is still far from done. We look to the National Forum as well as our other partners to ensure equitable hypertension control for all. Together, we can do this and increase hypertension control rates nationally.
The organizational recipient is the National Association of Community Health Centers. Accepting the award is Dr. Q. Rhee, President and CEO.
They are being recognized for their leadership in implementing self-measured blood pressure and other evidence-based interventions to improve cardiovascular health and reduce disparities in partnership with community health centers across the United States.
Hello, my name is Q. Rhee. I'm the CEO and President of the National Association of Community Health Centers. On behalf of NAC, I am so proud to be receiving this award from the National Forum for Heart Disease and Stroke Prevention. On behalf of our over 15,000 sites, or over 300,000 employees, and the 31.5 million Americans we serve, as the largest primary care system in the country that also works relentlessly to achieve health equity. Very proud to receive this award and recognize the importance of blood pressure control, hypertension management, and the role we play in the healthcare system to deliver those services and also achieve health equity, especially for populations that need it the most, whether they suffer from racial and ethnic disparities or rural, island, frontier disparities, geographic disparities. Thank you very much.
The National Forum Public Policy Award recognizes those who have been effective in advancing policy change that reduces the heart disease and stroke burden on a national, state, or local level. We are recognizing 2 individuals this year. The Honorable Eric Holcomb, Governor of Indiana.
He is being recognized for leading the state of Indiana to strengthen local public health to prevent heart disease and obesity, increase tobacco cessation, and improve maternal health through the passage and implementation of Health First Indiana.
Hello, I'm Governor Eric Holcomb, and I am deeply honored to receive the National Forum Public Policy Award. This recognition obviously belongs not just to me, but to the incredible team of individuals who have dedicated their time and energy to strengthen local public health in Indiana for years to come. Together, we've made great strides in our pursuit of better health outcomes for Hoosiers, and we'll continue to champion the fight against heart disease, stroke, maternal health, and so many others. The list just goes on and on and on. So we thank you for this award, and thank you for your unwavering commitment to healthier communities.
The second recipient of the National Forum Public Policy Award is Danette Smith.
She is being recognized for her tireless efforts in heart disease and stroke prevention policy and advocacy, ensuring the patient's voice is heard by Congress and state legislatures, resulting in increased access to preventative treatments.
Thank you. I'm truly humbled and blessed to receive this award. Thank you to the National Forum for this incredible honor. Let's continue to ensure that the patient's voice is heard.
The National Forum Commitment Award is given to an individual who has made outstanding contributions to the National Forum. Dr. Warren A. Jones.
He is being recognized for his dedication, insight, guidance, leadership, inspiration, and unwavering support that helps strengthen the National Forum's impact on cardiovascular health and health equity.
First of all, I want to say thank you very much for considering me for this critically important award. I do what I do out of love and commitment to my family and my community, and that's what I found when I came to the National Forum, an extension of family committed to community. Thank you very much for recognizing my passion.
The National Forum Chair Recognition Award recognizes extraordinary service. Betsy McKay, Senior Writer.
She is being recognized for her exceptional public health and medicine reporting that elevates public awareness and understanding of how cardiovascular disease affects individuals and society and how it can be prevented.
Thank you so much. I want to thank the National Forum for Heart Disease and Stroke Prevention and the chair for recognizing my work and my independence as a journalist to investigate and report on the reasons why heart disease is still the leading killer of Americans and why stroke is a major cause of death, despite all the advances in our society over the past half century.
Tribute to outgoing leadership. The National Forum would like to thank Dr. J. Bhatt, Managing Director, Deloitte, Mark McEwen, journalist, health advocate, stroke survivor, and Dr. Carol Watson, Director, UCLA Barbara Streisand Women's Heart Health Program, for their many years of dedicated service on the National Forum's Board of Directors. Incoming leadership. Officers. Dr. Marcus Plescia, Chair, Association of State and Territorial Health Officials. Dr. Michael Kropp, Independent Health. Warren Jones, Professor Emeritus of Family Medicine, University of Mississippi Medical Center. Darwin Labarth, Emeritus Founder. John Clymer, Executive Director. Counsel David Zook, Chief Scientific Advisor Dr. Stephen Sidney. Incoming directors: Juliana Crawford, American Heart Association. Rosemary McGillen, American Red Cross. Dr. Ileana Pena, Thomas Jefferson University. Federal liaisons: Dr. Brandon Taylor, Department of Defense. Dr. Lawrence Fine, National Heart, Lung, and Blood Institute. Dr. Walter Koroshetz, National Institute of Neurological Disorders and Stroke. Emmeline Okiai, Office of the Assistant Secretary for Health, Office of Disease Prevention and Health Promotion. Janet Wright, Centers for Disease Control and Prevention. We would also like to recognize those individuals elected as directors just a few minutes ago. The Honorable Jerome Adams, Margaret Guerin Calvert, and to a second term, Rosemary McGillen. This concludes the National Forum Honors Program. I will turn this back over to Dr. Marcus Plescia.
Okay, and reviewing the chat box now, I see that there is no new business that has been submitted into the chat box, so I will make a motion to adjourn this meeting.
I second.
Okay, and without objection, the annual business meeting is adjourned. To conclude the National Forum's 2023 meeting, I'm passing this on to our Executive Director, John Clymer.
So let's close the day with a few final pieces. Many of you have put on conferences and meetings, so you appreciate all the work that goes into a successful one. I want to recognize those whose work behind the scenes has translated this meeting from the drawing board into reality. Julie Harville led the meeting in preparations for the annual meeting. Stacy Resendez, Whitney Weber, and Brooke Bryson organized the panels, registration, communications, and more. And John Bartkus produced this virtual meeting, smoothly stitching together its many moving parts. Thanks also to Novartis and Boehringer Ingelheim for sponsoring the meeting and your no-cost participation. In the spirit of continuous improvement, please take a moment to provide feedback on this meeting using the short survey link in the chat box. Now, everything that we do in public health and healthcare that moves the needle on health equity is important. We can and must push the levers within our reach to improve health equity. So I challenge you to become part of a new phase of health equity action. The goal is the same: attainment of the highest level of health for all people. The objective in this new phase is to help people across the political and ideological spectrum see how programs and policies that improve health equity will help them achieve their goals, how their boats will rise as the tide of health equity rises. Now, let's take action.